So do you need to switch your implants out at 10 years? Yes or no? So where did this come from? We know that with older implants, they will start to weaken, and this usually happens 8 to 11 years in. And then they will start to break, which is 11 to 14 years in. So as you probably guessed from those numbers, 10 years would hopefully be the sweet spot that if you switch them out, they would be less likely to rupture. And rupture can be a big nuisance, like with a saline implant when you all of a sudden go flat. And it can also be a major problem, like with a silicone implant, where it causes a contracture and you could even get silicone within the breast tissue with the older generation of implants. So there's surgeons that'll tell you just wait if there's a problem, but the problems could be really terrible and expensive to fix. So switching them out is often an easier, less expensive option. So it's really how risk averse are you? And I had someone tell me once, it's not like a tire. It's exactly like a tire. You want to switch it out before it becomes a problem because we know statistically they will become problems. Now, the newer generations of implants are sturdier, we have less trouble with rupture, and they're cohesive. So when they rupture, they are less problematic, but they're still problematic. So what is that sweet spot? I'm not sure I know, but I would imagine just based off of what I'm seeing, it's probably closer to 20 years. So as a patient, it's really up to you what you do. So if you're not horribly risk averse and you are following up with your imaging as required, I think it's completely reasonable to not switch them out, especially with these newer generation implants. If you are very risk averse and just don't want to deal with problems, say you're 15, 20 years in, it's also completely reasonable to switch them out to a newer set of implants. Now for older generation implants, I do think you should consider switching them out because I always find them ruptured when I go in, and these are the implants like pre-moratorium. Now anything that came from 2005 on, I think it's reasonable to not switch them out on a schedule as long as you're doing imaging. So hopefully that answered your question. Let me know if there's anything else.